feels like a family gathering. Don't you feel like a family gathering here? I do hope that this afternoon is going to be a safe space for us to share our own stories and dig out the family laundries. Be a good laundry and bad, a dirty laundry, whatever, right? So mental health is complicated, let's say that, right? So I'm really glad that you're here to share your stories and provide your expertise and insights so that we can collectively find some solutions to help our community. So my name is Lily Chen. I'm the Executive Director of UCA WAVE, and I've been here since 1988. So English is my second language, and that's one of the barriers we face. But I will pass to my wonderful moderators, and Tanny Bick and Perry Chen, and they are the most passionate and talented mental health and behavior experts on the national level AAPI. So I have the privilege of working with the last 2 years. So I'm going to pass the mic to them, and thank you so much.
Hi, good afternoon. How's everyone doing? Good. Good. Are you excited about today's event?
Yes.
Okay. First thing first, there are two organizations that I really want to share our appreciation to them. First is our Triangle Community Foundation. We cannot make this event happen without their support. So thank you for your generous support, especially in this critical time for our country. And then, thank you. I also wanted to send our appreciation to Blue Cross Blue Shield North Carolina Foundation. In order for us to submit a proposal to Triangle Community Foundation, they also give us support. So Blue Cross Blue Shield, if you're here, thank you. So we have about 2 hours today before dinner to accomplish this list. And there are 5 more pages after this. So we are grateful for Lily to give us a welcoming, and then we'll do some housekeeping and restate the purpose of today. And then we are going to do an icebreaker in the room so that we get to know who is who here. And then we have 4 sets of presentation. We have over 10 speakers. They are all wonderful. And then we are going to make sure everyone will get a chance to speak. We are going to have an open dialogue at this event, and then we will close by Dr. Houghton, and then we will do dinner. If you don't get to speak today, you're not getting dinner. So another thing that I wanted to say is we are going to produce a report after this. If it is okay that we will be recording this section, audio recording, is that okay? How many of you have seen this? I feel like I get it from the museum. So I'm going to turn it on and make sure it works. And then we are going, as I said, we're going to produce a summary after today's event. So it's on recording now. And then we're going to talk about some ground rules. Here are a few things that I think of when I drove down from Maryland. Let's start on time and end on time so that we get dinner on time. We stay on topic, and today's topic is about mental health solution and resources. I know that we are going to talk about the needs and other related topics on mental health, but let's focus on these two as much as possible. Make sure that we have equal participation, meaning that we will share the mic, we will share our wisdom, we will share our experience. Let's practice active listening. It's a 2-hour conversation. It's going to be long, but let's respect each other. Let's speak respectfully. And then whatever we say in this room will stay in this room. So that we are creating a safe space for ourselves to share what we have in mind. Would that be okay? Anything else? Anyone wants to add anything?
Say anything?
Okay for now? Okay. Logistics. Bathroom is outside. That's the thing. And then we have snack and drinks. Make yourself comfortable. You can feel free to walk around if you want to. You can stand up if you want to. You can sit down, of course, if you want to. And make sure we practice self-care. And today's topic is on mental health, and we have speakers who are going to share their personal story. That may trigger some of your experience and maybe trigger your thought. So self-care is important. If you want to take a break, feel free to do that. If you want to go out and get some fresh air, you're very feel free to do so. Is that okay? And this is the most important part. Make sure that we enjoy and learn from each other. This is the entire purpose of this event. We are going to discuss many things related to mental health. We are talking about the solutions, some of the best practices. But let's make it a casual conversation, enjoyable conversation that we will be able to gain something from each other. And this is the purpose statement. As a high-level strategic asset mapping focused on conversation from all of the leaders, all of you are the leaders of the community, to identify some behavioral health needs so that we can achieve behavioral health equity for the AAPI communities in North Carolina. And the discussion, the reason why I wanted to put together a summary is because that summary would inform the UCA Waste strategic planning. And that's why it's very important to hear from every one of you so that we would be a part of that strategic planning, which is going to be a key for UCA Waste for the next couple of years. So your conversation would directly contribute and impact the work on the ground for UCA. So this is the icebreaker activity on Mentimeter. How many of you have used it before? A couple of you? Okay. So this is a very user-friendly, sounds good. So the first thing this is a warm-up question. So what I need you to do is you can either scan that QR code, and I would want to see if I can move it up so it's easier to scan, or you can go to menti.com and enter the code on the top. MENTI. Oh, someone's already responding. I never heard of this food before. Alligator?
Alligator. Alligator's good.
Ice cream? Ice cream? Okay.
Ice apple. These are so interesting. Right.
If you need help, feel free to let me know.
Snake gulp kangaroo. Wow. Ooh, cicadas. No. Oh, balut. I've always wanted to try that.
Okay, 5 more seconds.
Okay, sorry.
5 more seconds to put in your response. Wow, very unique.
Very unique.
Very unique. That's a good question.
Please invite us when you have these amazing meals again.
Oh, someone typed dumpling.
Nice. Very nice.
All right, so you got it?
So we're familiar now how to use Mentimeter.
Yes.
Okay. Lizard, scorpion. Wow. Okay. Next one.
The next one, it should be popping up on your screen, right? So enter your name, job title, organization, and email. This is a way to get to know who is in the room. We have about 40 to 50 people in the room. This is a big group. I feel bad for some of those has the longest domain name on the email. That would be a very long typing. Your name, job title, organization, and email. And if you want, we can publish this slide and send it back to you. Would that be okay? Thank you, thank you. Okay, the next question is, which of the following options best describe your primary area of focus? I know many of you have multiple strengths and talent. Pick the one that best describes to you. Local government, mental health provider, academia, philanthropy, CBOs. Okay, do we kind of get a sense who's in the room? Good, good. Okay,
Excellent.
I think that's it.
Oh, yes, sorry.
So I will go back to the slide deck. We are supposed to show this trailer to you for the Silent War documentary that the UCA Wave team has spent a lot of time and effort to put it together. Unfortunately, the facility doesn't
Allow us to.
play that. It has a blockage on the Wi-Fi. So what we are going to do is make sure you come to the conference tomorrow. There will be a section dedicated on that, and then we are going to send you the link as well. So it's a 2-minute trailer that you can play on your phone. If your phone is not connected to the Wi-Fi in this building, you probably can do it, but I'm not able to show it on screen for you. Okay, my apologies.
Did you want me to? And I know we just want to acknowledge the director. He's here.
Oh, Chen Fu.
He's Director Tom, who has been 4 years, over 60 people and 15 cities, and labor of love, truly. And so thank you so much. And Miss Rainey and Allison, where are you? Allison.
I'm sorry, I'm hiding.
Allison is the director. I'm so sorry, yeah. And then the beautiful program book created by Allison.
Yes, thank you, Allie.
Thank you. Okay, without further ado, I'm going to turn it to Jenny.
Thank you, Carrie. Hi, everyone. That was amazing, and we're going to keep this momentum going. So, Pooja, we get some extra time. Yay! So the format for these flash presentations will be, we'll have the presenters come up and speak. We'll be, having the nice little chime. I'm hoping that we'll have some room for questions, so we'll kind of, keep an eyeball on things. But that being said, let me first welcome to the stage our first panel focusing on setting the stage for this event. We're going to hear about behavioral health needs of the AAPI populations and a story of the challenges and resiliency from one of our own UCA Waves volunteer with lived experience. So without further ado, I'm going to welcome first Pooja Mehta, and then we'll have Johnson and Chen and Angel Luke come up afterwards. And I think just really quickly, Johnson and Angel, do you want us to set up 2 chairs up front for you to kind of sit directly across from each other? Would that be 即係兩個凳咁樣，你哋可以坐喺度咁樣對方咁樣講，係咪最好咧？企都得。Okay, up to you. Whatever you're comfortable with.
Guess one language Kenny speaking.
That was Cantonese. I can't do Mandarin.
No, actually I think it's Arab.
Maybe some French. I'm going to turn this over to you, Pooja. If you want to sit, if you want to stand, or however. And there's a clicker too if you wanted to, or if you want to just have it. However you.
All right. Hello, everyone. My name is Pooja Mehta. I am the Asian American Community Outreach Lead for the State Department of Mental Health here in North Carolina. I am coming to you from doing mental health policy and political strategy work for the last few years in DC, and a lot of what I'm going to be sharing in my presentation has kind of stemmed from my experiences in that space. Before we start, I do just want to take a minute to thank the UCA Waves team and Tenley and Perry for giving me the honor of kicking off this vitally important conversation. And I also just want to thank all of you. I never could have imagined a space like this could have existed. And every single one of you here today is making that happen. And so I just want to encourage us as we're going through the conversations today and tomorrow to just take a pause and reflect on the fact that we are here, what that means, and what that is building. So thank you all. Full disclosure, mental health is my passion, graphic design is not. So apologies for the rudimentary nature of my slides. All right, so when we are thinking about mental health, or at least when I'm thinking about mental health, I am thinking about two things. I'm thinking about how are people engaging with the current system, and I'm thinking about how people are shaping the future system. Engaging with the current system, for me, breaks down into two main buckets. So that is services. So what are the types of services that are available, both long-term, short-term, crisis, etc., peer-led, what have you. And then the accessibility of those services. That includes language access, that includes being able to afford it with or without insurance, etc. And that includes the circumstantial social drivers of health. You know, you can't really engage in mental health if you do not have a safe space to sleep, etc. And then shaping the future system. For me, that falls into advocacy, both community advocacy, you know, making sure that the systems that we are part of in our schools, in our homes, in our workplaces are amenable to mental health, as well as policy advocacy, big advocacy, shaping the systems holistically that we are all a part of. And then research, the scope and root cause of the problem, as well as the effective interventions for folks who might be struggling. When I historically have been in these conversations, Asian Americans are usually not represented, both in the people who are having the conversation and in the topics that are discussed. And for me, that doesn't really make sense. Asian Americans are the fastest growing demographic group in the country. North Carolina is no exception. Between 2010 and the 2020 census, the Asian American population in North Carolina grew 68% and continues to skyrocket. Statewide, we make up about 4% of the population, but we're heavily clustered. For example, where I live in Morrisville, we make up at least 50% of the population, if not more. And yet, we are incredibly underrepresented in the mental health care system. You know, we are the least likely to seek mental health services. We are one of the most underrepresented groups in providers. There are very few resources available in any Asian language. There are high rates of, I can't read this, underinsurance and uninsurance within our community. And within shaping the future system, like I said, our voices are not included and or considered in the conversation, and there's very little funding for research targeted towards the needs of our community. And why is that? My theory, the comfort that we have around these issues is very low. There's a lack of education within our community. We do not have the systems to be able to recognize the signs and symptoms. We don't know what resources are available. We don't know how to navigate the system. That stems from a lack of awareness, a lack of acknowledgement that these issues even exist within the community. And for me, I'm going to take it one step further. It is rooted in a lack of safety. Now, what do I mean by that? In North Carolina, the best data that we have shows that upwards of 60% of the Asian American community here is an immigrant. So that means a majority of us have either come from another country or are the children of someone who has come from another country. When you come here, there's a huge adjustment, right? I know for a lot of you, I am telling you what you already know. You are adjusting to a new life. You are seeking social connection. You are trying to find ways to engage with your culture and with your religion. And so you go to these community groups. You go to these places where that is already embedded for you. This is just a smattering of the examples that are of community groups in the state of North Carolina. And those groups are usually very welcoming. They have open arms. They're here for you. But when it comes to topics like mental illness, addiction, domestic violence, what have you, suddenly not so welcoming. Suddenly not so open-armed. And so you're kind of faced with a choice. You can either bring these issues up within your community and risk being ostracized from this infrastructure that is, at least in my experience, your entire world. Or you cannot. And you can seek help from external sources, like NAMI, like AFSP, like the local service providers, and those kinds of services. The thing is, like we talked about earlier, those external groups, they don't really have resources that are tailored to your needs. They don't have resources that are rooted in the cultural understanding that you have. They don't have resources that are available in your language. So what option does that leave you? You talk to a stranger on the internet who has stories that resonate with you, and you go to her and you say, I have this experience too, but please don't tell anyone. And so what happens is you have an ecosystem of people, dozens and dozens and dozens and hundreds and hundreds and hundreds of people from our community who all think they are the only one who are dealing with this. And why? Because our community does not feel like a safe space to have these conversations. It does not feel like a safe space to go to, even though the reality is the entire community is struggling. What do we need to do? We need people to feel safe confiding in their community and in each other. We need those communities to be advocating within themselves and externally to adapt resources to be accessible to their needs. And then those two entities together need to be pushing for the bigger system to have services that are accessible, policies that are serving us, and research that is helping us figure out what the hell is going on. And that's what we're trying to do at the state. My initiative, seeks to really facilitate that, really seeks to work within the community to start making our existing spaces where we go for so many of the other aspects that make life easy to live, a place where we can also go for help around these topics that historically we haven't been able to. And it's challenging. It's already challenging. Some of the things that, are really vital for this to be able to succeed is, we need direction setting from community-based organizations. We need the community-based organizations to be coming to us and saying, we want to be active participants in this. We want to help co-create this with you. Otherwise, we're doomed from the start. We need active listening and adaptation from the broader mental health system rather than a dismissal of, well, you guys aren't really being loud enough, or it's going to be too difficult to reach out to you, so we're just going to not. We need creativity around funding. For example, a majority of my funding is coming from federal grants, which I cannot use for food. Food is a universal language that I do not have access to. And then navigating the current moment. I don't think I need to say more on that front. But I am hopeful for so many reasons. Like I said at the top of this presentation, I'm hopeful that this conversation is even happening. I am hopeful because this conference is happening, that we get to spend a full day and a half focusing solely on the needs of the Asian American community, both holistically and individually, because let's be honest, this checkbox is not serving anyone. And I'm just so grateful to Director Crosby and Secretary Songbhai for recognizing the need for this, right? For when, about a year ago when I reached out and said, hey, I'm looking for somewhere to be able to do this work, they said, come here and do it. That is commitment. That is a level of acknowledgement, investment, and drive for change that, again, I never thought would be possible. The literal translation of Tarang is ripple effect. And through the conversations and the actions of today and tomorrow and beyond, we are going to be able to empower members of our community to create those little droplets of safety, those little droplets of conversation, and those little droplets of progress that are going to ripple out and create the change that we all desperately need. Thank you all for being here. Thank you all for letting me set the tone of this meeting, and let's get to it.
Thank you, that was incredible. And I'm going to welcome Johnson and Angel up next.
Gentlemen, good afternoon. My name is Johnson Chen, and I'm from Foshan, Guangdong.
那在2年以前，我们全家通过投资移民的方式来到美国，现在定居在 Cary。
2 years ago, the whole family moved to Cary on the EB5 program.
那么我今天分享的一个 topic 是新移民的一个心理历程。
Today's the topic about the new immigrants and how their hard journey to move from China to here.
作为一个新移民的家庭，这2年内我们经历了很多刻骨铭心和非常揪心的事情。
As the new immigrants moved here in the past 2 years, we certainly experienced a lot of trials and difficulties to live here.
其中最难忘的一件事情就是给我女儿看病的，有一次看 agent care 的一个经历。
Out of all this experience, one that leave a really deep remark in my heart is I took my daughter to urgent care and the whole process.
在2023年的12月份，那是一个非常寒冷的冬天。
2023 in October, a very cold winter starts.
那天我的女儿她突然觉得心脏的部位有不适，我们被迫去看 urgent care。
And one day, she suddenly felt discomfort around her heart, and new immigrants were forced to take her to the emergency care.
我们通过找寻保单上面的网址，找到了我家附近的签约的诊所。
And we have medical insurance, and according to the clinics provided on the website, we pick one that's nearest to our home.
但是我们去到的那2家诊所里面，他们告诉我们，你的保单的保险公司跟我们诊所并没有签约，因此拒绝治疗。
But after trying 2 clinics, we were told and we were rejected that your clinic doesn't have a contract with us.
最后我们选择了一家医院，就是这一家。哦，sorry。
Long story short, while he's seeking, they finally find someplace. He's trying to find, okay?
我们最后找到一家医院是叫WakeMed 医院，他同意收治我们家的孩子。
The one that finally accepted to take our child in is WakeMed.
所幸的是，整个检查治疗过程非常的顺利，孩子也没有太大的问题。
Fortunately, the whole process went through smoothly, and my daughter is okay.
当我们认为所有的事情已经告一段落的时候，其实我的痛苦才刚刚的开始。
After we thought we finally put a period to this dramatic and a little bit traumatic experience, my heart journey just started, followed with 8 months of it.
在接下来的8个月时间里面，我们花了5次的时间沟通，每次超过1个小时来进行整个理赔的过程。
During the following 8 months, we had 5 times communication over the phone trying to get the health medical insurance claim, and each time it takes about an hour.
这件事情让我们觉得非常的痛苦和无助。
This experience made us new immigrants feel painful and helpless.
在去年的某个时候，相信大家都有看一则新闻，这位仁兄被刺杀了。
Last year, I believe many of you know on the news that the CEO of the United Healthcare was assassinated.
回想当年的一个过程，我们觉得，在作为一个父亲，
In retrospect, thinking about the experience as a father,
作为一个父亲，在当时你的孩子需要你为他撑起一片伞的时候，你却孤独无助。
as a father, when your child needs you to be the sky, to be the umbrella, to cover her, take her under your wing, but at that exact moment, you feel helpless.
本来我投保，保险公司医治孩子，保险公司给予理赔，这是我们所耳熟能详的契约精神在哪里呢？
I ask myself, where is the spirit of the contract, honoring what you promise? It should be that hard, the process that we claim the medical insurance.
我想这是我人生的一个 至暗时刻，这件事情给我带来非常大的心理创伤。
And this starts the darkest moment in my life, and it traumatized me psychologically.
在我人生的至暗时刻，我依然坚持花费了比别人多5倍的时间和精力去学习。
Even during the darkest moment of my life, I still insist on growing. I spent 5 times more time than other people to study on my insurance.
并且取得了我的 life insurance 的一个执照，并且持续到今天，每一天都在持续的学习。
And that journey paid off. I got my life insurance license, and till today, I continue to study every day.
我想这是别人的一小步，却是我人生的一大步。
Maybe to other people, it was just a small step, but for me, that's a big leap.
我在想我的抑郁的来源的 source 在哪里？我觉得应该是来自于2个方面，一个是内忧，一个是外患。
And I asked myself, what's the root cause of my depression? And I believe it came from 2 components. One is the internal worrisome, the other is the external burden.
谢谢。内忧会造成整个中国国内经济的通缩的情况下，会造成以下3个方面的问题。
The main stress comes from the economic depression from the domestic situation.
房产的贬值超过30%到40%。
My real estates, the estimates depreciate about 30 to 40%.
各种理财产品相应的暴雷，并且甚至血本无归。
And a lot of financial products has got depreciated, and some you even lost your completely principal.
还有我们个人的借款，借款人拿了我们钱以后，人间蒸发。
Some are, we have personal loan to other people, business partners, and then they just completely vanished.
至于外患，就是我们在美国的生存环境中，我们的英语沟通能力不足。
And the external factor, as a new immigrant, we moved here, and we have strong language barrier, and that stops us from having a smooth communication.
以及对美国文化的不熟悉，对事情的流程不熟悉所造来的很大的困惑。
And the confusion that arises from not understanding the culture difference, the system process, that we couldn't navigate everything smoothly.
会造成衣食住行各方面没有得到很好的安顿，心里开始焦虑。
And for the basic need that we couldn't settle very nicely, where we live, how do we travel, and without those fundamental needs to be guaranteed, and we caused us a lot of anxiety.
那么我怎么样 overcome 呢？首先，非常感谢在丽丽的帮助下，我们家的女儿去参加了一个夏令营。
How do I overcome all those hardships? So, thanks to Lily, my daughter went to a summer camp for leadership.
那是今年夏天在 DC 举办的 UCA 华人青年领袖的培训班。
That leadership camp is sponsored and organized by UCA for the youth leadership.
同时，我们也积极的参加Sue和 Bella 的选举活动。
Also, we actively supported our community person, Bella Huang and Sue Mu, to run for city council.
这些活动让我家的女儿找到了她热爱的、她未来的职业规划的方向。
Through this community activity, my daughter found her own passion and the direction for her future career.
我在想，虽然今天的我已经初步的走出抑郁的阴霾，
I'm thinking to myself, today I would consider myself leaving the dark cloud of the depression.
我觉得有3点可以分享给大家我的经验。
I want to share with all of you 3 points that help me to overcome depression.
第一个是要结交同频的朋友，
First of all, make connection, make friends with people who share your core values.
正如我们家遇见了同频的新宇，通过他我们认识了 Lily。
Just like our family, first we met Xinyu, and then through her we met Lily.
通过 Lily 认识在座每一位优秀的你们。
And through Lily, I get to know all of you who's sitting here.
第二点，我们要降低自己的欲望和期望值。
The second is to lower our own desire and expectation.
如果孩子考不上杜克 ，UCA 也是不错的选择吧。
If your kids can't be accepted by Duke, UCA is not a bad second choice.
第3点，我觉得要走出去，找到一份可以跟社会链接的工作。
The third one, you have to overcome your comfort zone and find a job that connects yourself with the society.
哪怕是一份 part time 也是非常不错的选择。
Even it is a part-time job, it's still a very good choice.
那我今天的分享就结束了。如果你们觉得好，请记住我的好；如果我分享的不好，请记住我本人就好。
If you like what I share, remember me and all the goodies I share. If you don't like it, just remember me.
谢谢温文尔雅的 Angel 来做我的 interpreter， 谢谢。
And thanks me, okay. I'm just gonna skip that part. It's my pleasure to help the community to help you.
Appreciate it.
Thank you both so very much. That was really incredible. And thank you for sharing your story. And thank you, Angel, for interpreting. We also wanted to demonstrate what it's like for many of us, right, who speak another language, helping family members. And again, I think if you think about this both in the mental health, substance use, and even primary care space, this means that your 15-minute touch base with your doctor is not 15 minutes, right? So some of these things we have to think about as well. Let me go on to the next presentation. Our next panel presentation is going to be provide us with a look into the various systems and services that focus on behavioral health, which also impacts the AAPI community. We're going to start with our government level, county, and then school system perspectives. Please join me in welcoming James Miller, Denise Foreman, and Tanyetta Sutton. So I'm going to start with James first.
Thank you very much. And I probably don't need this because I am a loud person, but if you would rather...
Yes.
Okay, you would. Okay. Well, thank you so much for having me. This is very last minute, so I had to write a speech to make sure that I was not going to stray off of any talking points that I shouldn't be talking about. But I am honored to speak with you today, and I am taking the place of Kelly Crosby, our amazing fearless director for the Division of Mental Health, Substance Use Services, and Developmental Disabilities. She's off saving the world, doing something in New York. I'm kidding. She's at the UN right now, actually, and it's fantastic. But my name is James Miller. I use he/him pronouns. I am the current Community Mental Health Block Grant lead director and the LGBTQIA community liaison at the Division of Mental Health. It is an honor to speak with you about the transformative and forward-thinking work that the division is doing right now. And as a personal note, I have grantees here. Lily, you're amazing. You're amazing. Pooja, clearly, you're amazing. All of your work just makes me so happy to be here. I spent 10 years as an executive director, so I understand a lot of the struggles that individuals here are going through, funding, and again, the world we live in. So you can just call me a proud granddad right now. So thank you. But to get back to the mission, the heart of the mission is simple and powerful here in the state of North Carolina, where every individual, regardless of their mental health status, substance use, or disability, can live a healthier, happier life and a more self-directed life. And today I'm proud to share that we're turning that vision into bold innovation and strategic investments here with deep community collaboration. The 2024 to 2029 strategic plan that we have in place outlines 7 key priorities. And it spans from expanding healthcare and access to care, strengthening the crisis response, building a more resilient workforce, amplifying recovery services, and that's just to touch the surface of what we're actually doing. Even looking through this, a lot of people, I've never really worked in an organization where I've had such an incredible focus on lived experience. And I think that is the key that we're looking at for mental health and the changes to the systems that we have in place now. So one of the most exciting things that I'm not a part of, which is fantastic, because I'm not in the substance use world, but the mobile opioid crisis and treatment centers that are going around that just got rolled out, incredible work for individuals that have significant barriers to care, significant barriers to accessing anything. Our homeless populations, our individuals that live in rural areas, our just individuals that have been shunned by society. And again, as a queer Jew in the South, I can kind of reflect on that and say, yes, I understand and really care about that deeply. And another piece that we're working very, very hard on are CCBHCs, Community Behavioral Health Centers. I hate acronyms, guys. Certified Community Behavioral Health Centers. Those are centers that essentially look at putting all the core pieces of care under one roof. So your physical health, your mental health, substance use services, all of it in one place. Again, making it easier to access the care that you need. And so these are comprehensive, accessible, and trauma-informed. And that is one thing that we have to be focused on in looking at the services for our communities that we serve. We're also proud to support our youth, and I would be remiss if I did not say that Waves being a grantee here and focusing on youth mental health, especially in the queer community. Thank you. I grew up here, so I know. But also thinking about how we're funding NAMI, and the largest grassroots organization in the country doing mental health, and NAMI on campus. We're looking at Talkspace and Chess Health, which are both incredible resources that are free for our young people, that are accessible on the internet completely. They're app-based, they're anonymous, and they're free to access. Please use them. They're incredible. And again, it's celebrating a huge milestone. A couple weeks ago, we celebrated 2 years of our 988 program being in place and being accessible for all North Carolinians. Even those that don't speak English or Spanish have the ability to use Talkspace, which is an app that you can use when you're calling 988 to access different languages. So everybody can be served. It's not very well known that is a thing, but I really appreciate you. And we haven't forgotten about the backbone of what we're looking at right now, which is the direct service workforce. So in creating a direct workforce service plan, we're looking at creating certification pathways, proving compensation, which is huge, and launching a statewide DSP directory to better match professionals in their areas. So finally, through the mental health block grant opportunities, which I'm most excited about, that's my life, we're funding community-based initiatives that serve LGBTQ older adults, individuals with English as a second language, and then faith-based communities. Because we recognize at DMH that these are populations that don't necessarily always get funding from us or recognition whatsoever. So these projects are more than programs, they're lifelines, and we need to focus on that. So they reflect the care that we know we should be giving the communities that we serve. And we also understand as practitioners of this, I'm not a clinician, thank God, you don't want me as one, but everything has to be person-centered, community-driven, and accessible to all. So in closing, I want to thank you for doing everything that you can to serve the communities that we're a part of. And like I said, this is something that's very close to me, and I very, very much appreciate you all being here, just having this conversation in a community that has been looked over for so long. So thank you from myself and Director Crosby. I really appreciate it.
Good afternoon. I'm Denise Foreman. I'm the Director for Behavioral Health with Wake County. I've been here about 15, 16 years and have had lots of different titles, but at the heart of what I do is really trying to help our county lean into the best county we can be moving forward. And I am staff, but to do that, we count on our elected officials to help lead the way. And today we have one of our county commissioners with us, Ms. Cheryl Stallings. Thank you for being here. This is a passion topic for Ms. Stallings in a career. And so I really appreciate you being here and the leadership that you give to our community that allows people like me to do the work that we do. We have recently launched a behavioral health department in Wake County. That's not something we've historically had, and that's not something that you see in every county across North Carolina. And it's because of the commitment from our leaders. It's because of the response from the community crying out for support, crying out for help. And then two, what we're seeing at our state. We have an opportunity to partner with our state partners, with our nonprofit leaders, with academia, in a way that's unique, that not every community gets. And so we're really leaning into that in a way that I hope you all will find to be helpful for you all as you continue your journey beyond year 2 of your conference and really get involved in this work moving forward. So as I mentioned, we're a new department, and really our role as a department, we don't provide services, but we do help provide funding and invest in services that we find gaps exist. We help convene partners. We help do things like you all have done here. And then we try to help remove some of the barriers, some of the language access, or some of the access limiting your insurance, things like that. So our role is to really try to break down some of those barriers. We also have 5 focus areas in our work that we have spent many years working with our community at community meetings. We do a summit every couple of years and try to ask the community what's important to you when you think about the work that your county does for you. So we work to improve access, navigation, and coordination, just exactly what you talked about earlier today. We try to strengthen the crisis system. We want to make sure everyone experiencing a behavioral health crisis has somewhere to go, someone who understands what they're going through, and then someone that can help follow up when they're out of the crisis and help keep them stable in the community. We work with justice-involved individuals. Unfortunately, a lot of folks don't understand mental illness. They don't understand substance use. And so they end up getting involved in the justice system. And so we see too many people incarcerated that really need to be actively in treatment. And so we're working very hard with our justice partners to break down some of those barriers and get folks in the community. We very much want to support our youth and families. This is a new initiative or a new focus area for us because we're hearing more and more about the needs and the complications that our young people and their families are navigating. And so we're really leaning into this. We'll have a study going on later this year to really better understand the environment in Wake County and make sure we're targeting our areas of support in the right places. And then expand community support services. These are all those other things. It's not behavioral health treatment. It's not substance use treatment. It's housing, it's food, it's community engagement, it's transportation, it's understanding cultural barriers. So really kind of getting our head around how do we make sure that we're supporting our community beyond their actual behavioral health needs, because it's all integrated. So we were asked to share some specific resources available in the Wake County community, and you've heard some of these buckets of resources today, but I want to talk about some dedicated resources here in Wake County. On your tables, you've got information about the Wake Network of Care. That's an online database. It's available 24/7. There is no fee. And we have a staff person that works every day to make sure that that database is kept up to date, that it's got appropriate addresses, it's got accurate hours of service. And you can go to that website and put in anything that you may be looking for that's a resource in Wake County. It's limited to Wake County because that's who we are, but these do exist in some other counties. It's not in every county in North Carolina, but Durham does have one and some others do. And there is a translation button. It's available in 104 languages. I don't know how good it is in translating, but I do know that that is a feature, and that's something that's really important. It's been very important to our commissioners, and we wanted to make sure that was accessible on this website. It also has a mapping function, so no matter where you are in Wake County, if you're looking for a youth mental health provider, it's somewhere in Wake County, it can help find one that's close to you. Other resources that we have, again, was mentioned, but someone that you can talk to now, someone maybe that you can chat. We've got amazing programs, and I could have had a really long slide with lots of different phone numbers and things that you can call, but I want to highlight 3. One is 988. As James said, that's new. Not everybody is familiar with 988. 988 is available 24/7. You can text it, you can chat, you can call anyone, no matter what your payer source is, no matter what your native language is, no matter where you're coming from, everyone can access 988. We have a peer support number and Alliance number. Alliance is our local behavioral health provider that helps us navigate the complexities of the system. We have places that you can go in person. We've got 24/7 walk-in at Wakebrook for adults. We have extended hours of Awake Behavioral Health Urgent Care. That's a new concept. Again, not every community has that. But just like if you get the flu and you want to walk in because you can't get into your doctor's office, a behavioral health urgent care is available in Raleigh, regardless of your payer source, regardless of the source of your insurance. And the same for youth. We have a 24/7 youth crisis facility that you can walk into without an appointment, and anyone experiencing a mental health or substance use crisis up to the age of 18 can be seen at that facility. You can also get help in person. People can come to you. If going out somewhere is too hard or just doesn't work for what you need, we have mobile crisis teams that can go to you, whether you're an adult or a youth. And then we have ongoing recovery support services. Much like your WAVES, you have peer support groups, and I can't encourage you enough, get involved and volunteer. If you're not represented where you want to be represented, step up and get involved. Learn what you can learn. Mental health first aid is a great way to learn more. But there are a lot of organizations that are small, nonprofits. NAMI is small. There's not a lot of paid staff. Recovery Communities in North Carolina is small without a lot of paid staff. They count on volunteers. They count on bright people that are passionate and can give their time and energy to help others learn and get the support and the recovery that they need. So my encouragement to you today as I wrap up is become a peer, become an advocate, or a trusted voice for a family member who just needs somebody to talk to. Share the word about the resources that are available. It's not always obvious, it's not always easy to find. We're working on it, we're trying to make it easier, but it's not always easy. Learn more. Take those mental health first aid classes. Take those DBT training classes to help you as a parent. Learn these other skills and then apply them and support your family and friends. And then speak up. You're here today, that tells me you're active and you're speaking up, and help spread that. Talk to your youth, get them to encourage and talk with each other so that the stigma that has kept us from addressing our mental health and substance use issues is a thing of the past. Thank you.
Thank you, Denise and James, and I will welcome Tanyetta.
I might need you to stand up here. I don't need a microphone, but yeah, microphones make me nervous. If you stand up here,
okay,
yes.
yes.
Thank you.
I just kind of hold it like this?
Yes, that's
Okay.
perfect. Thank you all so much. It is likewise just such an honor to be in the room with so many people who are just as passionate to be with Denise Foreman, Commissioner Scholars, and so many about mental health. I have the pleasure and honor of hearing from children, students every day. I work for Wake County Public School System. I am the mental health coordinator. And I wanted to come from a different angle because so often we talk about resources, we talk about, oh great, got something to plug up. Can you hear me? Hello? 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 That's okay, I can just continue with her. Hello? I can just continue with her. Yeah, I'm good. Yes. Thank you. Great.
Just need to be a little closer, I think. You need to click to.
Oh.
Yeah.
Okay.
You just need to click a little closer to.
Hello?
You.
Hello? You can hear me? Okay, great. I have the honor of speaking to so many students a day regarding mental health, and I wanted to come from a different angle. I asked her, and I thank you so much, I said, if I had to come, what did you want me to say? She said, can you end and close with an action? Can you end and close with something to just encourage, because we all parents, we leaders, we community advocates, but I wanted to come also from a different angle from the mouth of a youth. We have a youth mental health advisory group in Wake County Public School System. I had the honor of meeting with some of them, and I said, hey, tell me what you would like for me to say if I was to go to a AAPI or WAVE or a meeting. What would you want me to say to community leaders, families, parents? And so I wrap it all up. Good afternoon. First, let me thank you for being here today. Your presence shows something very powerful, that you are deeply rooted about your child's future. And today I want to talk to you about one of the most important pieces of that future, your child's mental health. We all know that academics, sports, and achievement matter, but let's just be honest, let's tell the truth. None of those can shine if your young people are weighed down by stress, anxiety, or feelings of hopelessness. Mental health is not a separate issue. It is the foundation. Just as we wouldn't expect our children to succeed without food, sleep, or safety, we cannot expect them to thrive without a strong mental health system. The reality is very sobering. Across our nation, more and more young people are struggling, feeling isolated, overwhelmed, or uncertain about this world that they live in. The pandemic may have intensified this, but even before the pandemic, many of our students, our kids, were quietly, silently battling challenges that they did not know how to articulate or express about. And the truth is, as I meet with them, many of them are still battling those challenges. But here's the good news. You as advocates, parents, county commissioners, leaders, family members are the most powerful factors in a child's life. Studies consistently show that young people who feel supported, listened, and encouraged by parents, leaders, advocates, community, county resources, county commissioners, our politicians, are far more likely to bounce back from adversity and ask for help when they need it, and to develop the resiliency skills that carries them into adulthood. And supporting your child's mental health doesn't mean having all the answers, because we don't. It doesn't require a psychology degree or a certificate. It only requires your presence. It's listening without judgment. It's asking a very simple question. How are you doing today? And being willing to answer and hear, even if the response is not something you want to hear. It's reminding your child that their feelings are valid. It's okay not to be okay, and that help is within the reach. Let us also remember this. Our children, my students, I say all the time, are watching all of us. The way we manage stress, the way we talk about our emotions, the way we model self-care, all of this teaches them how to care for themselves. When we show them it's okay to ask for help, we then give them the courage to also be able to ask for help. And when they are hiding their pain, we give them the opportunity to face their pain with no judgment. So today, parents, leaders, county commissioners, politicians, advocates, I am calling you to action. Together, we can change the conversation about mental health. Together, we can ensure that no child feel alone, unseen, or unsupported. So here's the change I will leave with you. Start the conversation at home. Normalize talking about feelings. Check in with your child daily, not just about sports, grades, academics, friends. Just be able to hear what's in their heart and what is on their mind. Continue to partner with schools, organizations like this, community, and each of us will build a positive network of care. And above all, commit to being the safe place your child can always know they can turn to, no matter what the issue is. Because every child deserves to be heard. Every child deserves to feel valued. Every child needs to know that their mental health matters. Parents, leaders, advocates, all of you in this room, the time is now. Our children cannot wait. So let's rise, speak hope into their lives, and be the champions that they need us to be. Thank you.
Thank you so much, Tanyetta. Thank you, James. Thank you, Denise. That was really, really incredible. We got to hear so many perspectives and different layers. Now we get to go down a little bit more into depth, I would say, and we're going to hear from Dr. Mary Shen and Leanna Adrong to talk about the clinic and community level services. So I'm turning it over to Dr. Shen.
Oh, okay. All right. Hi, everyone. It's so nice to see everyone here. And I just have to shout out Lily Chen and the UCA Waves team because this is just incredible. I'm like almost in tears just hearing every speaker. And so I just really appreciate all of this. And I also had Sichuan food for lunch. So if I have a cough, that's why. Okay, so I'm Mary. I'm a former surgeon, and now I'm a psychiatrist in training in Boston. And this is where I care for patients every single day. So it's really inspiring to be here and see everybody here be so passionate about mental health in this community. And so for me, this is actually deeply personal. So I grew up in this area. I was born in Durham. I grew up in Chapel Hill. I went to Montessori school on Weaver Dairy Road, if y'all know where that is. I went to high school, college, med school here, so I was a townie for a long time. But, you know, when I was growing up, one thing that's really standing out to me today as we're talking and having these conversations is that back then nobody was talking about mental health. This is just completely different. Just to see all the resources that are out here, I'm astounded. This is also really personal for me because when I was growing up, I definitely could have benefited from it myself. My parents went through a really difficult, contentious divorce, and my dad left and went to Taiwan. And you know, a typical Asian family doesn't really talk about these things, so I was kind of left in the in the dust and not really sure what was going on. I got very sad. I lost a lot of weight. My sleep suffered, and then, of course, the worst thing of all, my grades suffered. So my mom, it was pretty progressive. She took me to see a therapist, and that was really, really helpful. But it was very hush-hush. It was very stigmatized back then. And so it was very, very, even though I was getting help, I still felt very, very low. And I have to say that looking around in this room today, like I said, I would have loved to have this level of support. And so just to see the progress that we've made in 20 years is incredible. And so I just want to really acknowledge everyone in this room. Well, let's just do a round of applause. I don't think I would have been able to imagine this, as I've said. And so 20 years later, even being here, so I never imagined I'd be able to be in a position where I could actually make a difference as well. And so we already know that there's a shortage of psychiatrists in the country. And I really want to highlight the fact that the data shows that when you have a provider that looks like you, it makes a huge difference. Your health outcomes are just better. I really want to highlight a story. So recently, this will sound random at first, but I met a guy at a networking event. And we exchanged numbers, we were talking, and he texted me out of the blue when he found out I was a psychiatrist. And he asked me, hey, my sister is an alcoholic. Can you help me with her? And I think it speaks to something on several levels. Number one, the fact that you feel like you're so siloed that you can't actually go to a doctor and seek help, even in this day and age. And then number two, how do you seek help when you are in these spaces, and so, or in this place? And so when I ended up talking to her, I actually found out that she did not have an issue with alcohol use disorder at all. This was really stemming from the fact that she had been sexually assaulted and had PTSD and was coping with alcohol, which is completely different. It really highlights the need of having providers who understand culturally sensitive care and are able to get people to where they need to go. We can have all these resources, but if patients don't know where to go and can't get the right treatment, then that's not the best use of that resource. And so I want to talk a little bit about what we're doing in Boston. And so again, I'm astounded by everything that's happening in North Carolina. So I work at Brigham and Women's Hospital, and we're piloting our first Asian mental health clinic there, and this is really exciting. And you think about how long there have been Asians living in Boston, and for this to be the first one at our hospital is kind of insane to me, but these are baby steps, and so we're very excited about that. We're also training residents, so future psychiatrists, how to provide culturally sensitive care. Things don't look the same when you're from a different culture, and so that's something that we're really working on too. So like a lot of people said, it requires related policy, it requires rigorous research, it requires education, it requires everyone in this room. And I wanted to put it out there that it is really important to have a provider, a physician at the table as well, making these decisions alongside you. Because even with the best infrastructure, and even with the most thoughtful policy, if you don't have providers on the ground delivering that care, then the buck stops there. Those children, unfortunately, are still not getting the care that they need and deserve. So we need providers that understand how culture shapes the way things like depression and anxiety present to differentiate PTSD from alcohol use disorder. We need providers that can speak with patients in their native languages and understand how to meet patients where they are. And then we also need providers who can connect families to community resources. I can't even begin to tell you how difficult it is for patients to navigate the system, but also providers. It is a huge training curve, and so being able to implement some of these resources and include training for physicians is vital as well. So this leads me to a couple of questions. I know that we're supposed to have solutions, but I have some questions. So number one, how do we increase the number of Asian providers? Having providers that look like their patients. And how do we destigmatize these roles? I have personal experience with this because I have a grandma who's 93 years old and lives in Beijing, and she's still telling people I'm a surgeon. So I'm well acquainted with this. And then number two, how do we ensure that every provider in the interim, as we recruit Asian providers, how do we make sure that all providers, regardless of background, are able to provide culturally sensitive care and have that cultural awareness to be able to give patients the care that they deserve? And then clearly I don't have all the answers, and so I believe it really takes a village, and I need you. I can't even begin to tell you how desperately providers need community partners like yourselves who have this knowledge of the system, who are creating programs, who are innovating in this way. And so I really, really hope that we can all work together and ensure that we are creating these solutions for these kids. We know that kids will go through hard times, but my hope is that they won't feel as alone when they're going through that. So with that, I want to say how deeply grateful I am to have this platform today, and I'm just deeply grateful to all of you and hopeful for what we can build in the future. Thank you.
Thank you, Mary. And I'm going to have Leanna come up, but I'm going to also show a really quick video.
I think we can do that later.
Later? Okay. Okay.
How long do we have?
You have about 5 minutes.
Yeah.
So. Okay. I'm going to. Oh. Okay. So you can click or hit the button. There you go.
Thank you.
Thank you. So during the pandemic, we lost my mother-in-law, who was an incredible woman. She was a chef. She was a housekeeper and a free babysitter. She lives with us, so that was her way of contributing because both my husband and I work full-time. A year later, we lost my father-in-law, and then I have a 7-month-old, and my mother was going through dementia. So I went to, go to work normally, come home. Thank you. And for a week, I just feel this tightness in my chest. I went home one day, and my husband, he just held me, and I burst out crying. For 10 minutes, I was just crying like crazy. And then I stopped, and then he said, "Did you see that?" I was like, "What?" A hurricane just came by and went so hard, and it just went away. So that was his way of like making a joke to help me feel better, right? So I was also in graduate school, so it was a lot going on, and it was during the protests, during the pandemic, so I was getting a lot of pressure from different people. And a proposal came in, and so I put in a proposal for $5,000 or $10,000, I can't remember, at my school. And the proposal was like, I call it the sandwich generation. I was like, here, me trying to take care of my mom, trying to take care of my kids, going to school and all that. And, you know, I need some help. We need some help. And I said, there's other moms in our community who needs help. So I didn't get the money sadly, but it's okay. Life went on. Life went on, and how do I move this? Okay, life went on. I was not a director then. I was a caseworker / vocational. Life went on in work. And I think just from all of that experience, it helped us group to all these programs. We went from one program, now was operating at like $99,000 to $100,000, and now this year we're at 1.3. Wow. So I'm very excited for my team. And then a couple years ago, this program I was so excited. I was like, somebody up there, like Pooja and James and others, like somebody is speaking our language, right? And I called one of our mentors. I said, Andrew, did you see this? This is my program. You know, I said, this is my program that I put in a few years ago. So this is where I'm here on the community level to share the experiences that we went through as a caseworker, as a mom, and all other hats that we wear, right? So we came together, and these are the partners that we've been working with since the pandemic, doing a lot of outreach, you know, making sure our community get all the vaccine, getting all the safety information that they were getting during COVID. So we partnered with the Quranic Bhutanese and Swahili speak community through Monday Gospel Mission. These are all the community partners that were working during the pandemic, but were not getting paid because they, they didn't have their own 501c3 status. So we've been mentoring them in the past year. So with our mental program, you know, we come up with this title. We need, like you all mentioned, Dr. Shen mentioned, people that look like you who speak your language and all that kind of thing. And then I think I'm just gonna fast forward, but you're welcome to share all these slides later. This is where our future dream, okay? So with all these, the organization's been operating for over 35 years, and now we have the getting declined for a $5,000 grant to getting a $500,000 grant is a huge, huge accomplishment for us that we celebrate every day. You know, we'll put a lot of people through training. We got some coming training in the next couple weeks too. But this is our future dream. This is a layout of our community wellness center that we want to build in Greensboro. So I would, for more information on how you guys support, we put some brochure on your table. Feel free to connect with us. And then I'm going to leave the last couple of minutes for you to play the video. And then you guys feel free to connect with, I have a team member here that's from our organization, Sanchi and Ming, and then also one of our community, one of our partner, who's with Strong Mind at UNCG as well, who does amazing work providing like therapy session to our community in Jirai, Vietnamese, and Red A as well. Thank you.
Thank you, Leanna. I am going to play this video. This one.
PTSD, depression, anxiety, trauma, and also displacement from their hometown.
This practice, stigma around mental illness community ties faith, and the cultural pride offer resilience. Providing culturally sensitive, trauma-informed support and safe spaces to talk about mental health can make a meaningful difference. Caregivers need care too. We understand your needs, your struggles, and want to help. It starts with us, and it starts now.
That's why at the Multi-Art Association of North Carolina, we are here to be of service to you all.
Naked Gospel Mission is here to provide support.
Mental Health, as part of the creative community with the Salem, is here to uplift others. The Bhutanese community health workers are here to offer assistance.
We have a team of community health workers to support our caregiver, youth, and elder. Through our mental health program, we want to make a lasting impact. Our goal is to improve the quality of life for our patients, clients, and caregivers through culturally competent care. We want to destigmatize the conversation around mental health, suicide prevention, addiction, and increase the trust between providers and patients. We're hoping to make this dream a reality through working through 4 main refugee groups in North Carolina. Our mental health wellness programs offers many things such as the wellness class, youth group, counseling, trainings, football.
More. Our services are free and available in Greensboro, High Point, and Winston-Salem.
At the Multi-Art Association of North Carolina, we are partnering with North Carolina Department of Health and Human Services, Kellett Foundation, Strong Mind at UNCG, and many of our community health workers to organize and provide a community-led solution to the mental health challenges that we have in our community. If you know anyone who needs help, or if you yourself are interested in learning more about our program, please reach out to us at 336-541-2447 or visit our website or social media. Tik nahulu tiktok, tapai iglo huluna. Pregi jang rang kriya kasay may diipo, kayuada, klay swat kal jin yuog sana. Tada di imaw klay rongrang, klay gwating mang klay MDA. Bray di itwa, klay ru mang MDA, amaw na, bray di ipo hong may edaw di ipo.
Thank you. Okay, let me go back to the slide deck. All right. Thank you again, Leanna and team. Our next and final session before we break into the open dialogue is going to be focused on philanthropy, but also talking about the programs that they fund and oversee. So please welcome Mr. Vic Armstrong and Ms. Natalia Siegel to discuss their work at the foundation and how we can partner. You want to move this one and plug in yours?
I don't need to plug next to you read from.
Oh yeah, of course. Okay. Whoops. I'll figure this out.
Okay, apologies. I'm reading from my computer here. I'll explain why I'm doing it. So good evening. First of all, let me tell you how honored I am to be in this space. I feel so privileged to be among you with this very vulnerable conversation. And like everybody else, I have to thank my dear friend Lily Chin, who was just a force of nature. Lily says, "Will you do it?" And I just say yes, and I ask questions later. And I also, I have to say, Pooja, we met like some years ago. I was director of Division of Mental Health here in North Carolina some years ago, and we did a webinar. And Pooja was one of the presenters on the webinar. And I didn't know her. That was the first time I had ever laid eyes on her. I just knew she had an amazing story, and she had passion and charisma, and she was going places. And I said, well, I got to keep an eye on her. And then the next time we engaged, we were both in national organizations. I think we met in D.C. or someplace. And now we meet back here again in North Carolina. So I say all that to say I take credit for your career. I'm going to talk a little bit about, and let me say, the reason I don't have a PowerPoint is because all of what I'm going to share with you today is information that really has not been released yet. So you're getting it not only hot off the press, you're getting it like in its pre-release form. One of the things I do is that I serve on the steering committee of the Action Alliance for Suicide Prevention, National Action Alliance for Suicide Prevention. And one of the things that we do is that we are the architects of the National Strategy for Suicide Prevention. And so one of my roles as a part of that work is I chair the Progress and Accountability Work Group, and that work group looks at what do we need to do to ensure that the national strategy is effective and actually works. And so I had the opportunity over the past several weeks to be a part of some what we call key informant interviews. And with those key informant interviews, we asked some 34 participants across different sectors what they look for in terms of data when they're thinking about funding, when they're thinking about partnering, when they're thinking about coming alongside organizations. And so we interviewed organizations like SAMHSA and MHA and AFSP, but we also interviewed philanthropists and funders in different organizations. So what I'm going to share with you is some of what they said about what they look for in terms of data. And I promise you, when it's published, I'll make sure that you get a copy of it. And so one of the things that they said was that when they think about uses of data for suicide prevention, they want to be able to identify those hotspots, those at-risk populations and geographic groups. We know, for example, in the AAPI community, there are some parts of the population where the suicide rate is especially high. And so they like data that can allow them to quickly zero in on where the hotspots are, where those areas are disproportionately impacted. They also like data that can be gathered in real time. So if you're able to collect data in real time so that something changes, you can pivot quickly, they can pivot quickly. Those are the things they're also looking at. They also like resources that can help them evaluate prevention trainings and interventions. So they like things also that can help them to be able to dispel myths and delve into what is true. Because everyone has narratives about this is what my community does, this is what but there's also data, there's reality for what actually is occurring. They do like both the quantitative and qualitative, so they like the stories, but they also want to be able to disseminate what is actually happening in communities. If you are providing a data dashboard, they like data that is accessible, timely, actionable, comparative, and hopeful. And so some of the features they're looking for include data that is simple, that is user-friendly, has user-friendly visuals, that has drill down capability so that they're able to drill down into what's happening at the state level, the county level, the local level. That is going to be extremely important, even more so going forward, because we know that a lot of the data at the national level has disappeared. And so it becomes harder and harder to get access to national data and to disaggregate that data. Data that you're able to gather at the local level that is actionable, funders are very interested in that. They like data that is customizable for different viewpoints. If you're looking at for policymakers, funders, educators, and for the local community. They like action guidance alongside the data, which reduces the risk of misinterpretation. So explanation about how you use the data, how the data is designed to be used. I have seen many instances in my career where data is not used for the purposes it was intended, and so the data can be easily misconstrued. Like comparisons across states, demographics, and sectors. One of the things that AFSP that we're getting more and more good at is looking at how do we look across the different geographies and subsets of the population and partner specifically with subsets of the population and create resources with the population that mirror the needs of the population. They're like a one-stop, consistent, curated resource that pulls data from multiple trusted resources. So the less they have to go to different places to find the data, the better they're able to use the data. They like data from trusted sources. So there's federal data. There's data you can gather from the CDC, SAMHSA, the 988 dashboard, National Institutes of Mental Health. So having data that is verified, data that is provable, data from national organizations. They're always happy to see that you're drawing data from national organizations, JED Foundation, Suicide Prevention Resource Center, places like that, AFSP. And then alongside that, also having data from your state and local systems like medical examiners, health departments, county level surveillance. So having that local county level data. I'm about to get the hook in a minute, so let me move on here. So some of the emerging themes were, again, they're like data-driven insights and data that is disaggregated. There are urgent calls to break down data by race and ethnicity. Funders still want to see data that speaks to the LGBTQ community, that speaks to geography and things like that. They like data that speaks to rural populations. That is one that is bipartisan, so anything that speaks to rural populations. Timeliness. Funders and policymakers stress the need for near real-time data to inform resource allocation. So the more real-time that data is, the more likely they are to allocate and fund that data. Trust, transparency, and neutrality. Transparency is a key factor in fostering the end user's trust. So they want transparency in the data. Integration across silos. Suicide prevention data should link the substance use, overdose, gambling, violence, workplace health. If you can link all of those things together so it works across silos so they don't have to have go to different places to get different information. And data that is actionable and hopeful. Dashboards should balance risk and protective factors, resilience and what to do next. And then centrality of lived experience, stories and qualitative data, especially those based in lived experience, have to complement that quantitative data in order to humanize those trends. And then elected officials love the story. So adding that story along with the data. And then alignment with the national strategy. As I mentioned, there is a national strategy for suicide prevention. So one of the things you're going to want to do is take a look at that national strategy and then look at how do your programs align with the national strategy, because the better you're able to connect to and align with the national strategy, the better you are going to be able to get some of these funders and resources to partner with you, because they also want to elevate the national strategy. And I'll stop there before I get the hook. Thank you.
Yeah, I don't want to break something. No, you're good.
Hola a todos, buenas tardes y muchísimas gracias a tenerme. My name is Natalia Siegel. I am so grateful to be here. Thank you so much for having me. I am a proud second-generation Colombian American, so I share a lot of experiences with y'all, and a lot of times what I've learned in my experiences, it's so universal. And so the stories that I've been hearing have really spoken to a lot of my family's experiences, and I just really appreciate everyone's vulnerability, and it's just been so nourishing to be here with other folks of the global majority. And I'm here to, oh no, whoops, can you hear me? Okay. I am here to talk about our organization, Triangle Community Foundation, and I know that I'm between you and dinner, so we are gonna make this short and sweet. All right, so what is a community foundation? Community foundations are grant-making public charities that are dedicated to improving the lives of people in defined local geographic areas. There are over 800 community foundations in the United States. There's multiple here just in this region. So they are all over the place. So this is, while I may be talking about my organization, if you do not live here, you have one that is local to you. Community foundations bring together financial resources from individuals, families, and businesses to support effective nonprofits in their communities. So as you can see, Community Foundation lives in the middle of this section here. We are partnered to donors, so we have more than 800 funds at Triangle Community Foundation that are created by community members here in the Triangle to support their philanthropic giving through grants to nonprofits and scholarships for individuals. We are also a supporter of and a funder of nonprofits, so we do discretionary funding directly from our accounts, and we also provide, besides financial resources, just general capacity building support and educational resources for nonprofits in the Triangle. we also serve as a convener and a community resource. So a lot of what we've been doing today here, we also replicate in a lot of different ways, focusing on our areas. And so we bring people together to further our mission to leverage our connections in the community. Awesome. So here's Triangle Community Foundation. We work with dedicated donors and strong nonprofits to guide gifts in a strategic way that fills in gaps, reduces inequities, and solves regions' most pressing issues. We consider the Triangle to be Chatham, Orange, Durham, and Wake counties. And so we support the nonprofits in there. There are over 2,500 nonprofits in the Triangle. So there's a lot of you guys, and so we're happy to help. As you can see, our mission is to inspire and mobilize giving, leadership, and action, and we do that through our values, and we hope to see them. This community, equity, legacy, curiosity, and leadership really reflected in the work that we do. So what is that work? So the foundation has really supported mental health in a lot of different ways. Since 2005, we've given over $7.4 million to mental health organizations. And I actually think that number is probably a little low because so many mental health organizations we also consider intersectional. And so you can see, like during COVID, we really focused, for example, with a lot of arts organizations because we understood the power of the arts and working in mental health areas, especially during COVID. We saw that was definitely a need, and so a rising tide lifts all boats. Supporting arts and mental health was a no-brainer. We also encourage and support to organizations, really starting COVID and beyond as intentional, and again, using that intersectional look to make sure that we are addressing mental health holistically. So one of the things that the organization does is provide grants to nonprofits. So for example, UCA Waves is one of our grantees, and we're so grateful to have y'all in our family now. So this was our 2025 calls for proposals. So I'm just showing you an example. There will be a 2026 one released soon. And also, if you are not, again, if you're not in the Triangle, you should look up your community foundation. I'm happy to help you. And you definitely will find other organizations in your area that have calls for proposals just like this, that are going to support organizations just like yours. So you can see, and again, we would consider a lot of mental health organizations to be intersectional in this work. So while you may not see one exactly that says mental health, we understand in the Community Foundation world understands that y'all live in among all this various different impact areas. And so, last but not least, again, we just want more information here for y'all. So we have nonprofit monthly office hours that are held the third Tuesday of each month at 3 p.m. It's a great place for you to come and learn and hear from not only our staff, but also hear and connect with other folks that are in the Triangle. Again, you're welcome to call in if you're not in the Triangle, and we'll be able to help you find a resource for you in your region. And then if you'd love to learn more about being a donor of Triangle Community Foundation, connecting with me or some of our staff members, please check out this QR code here. Thank you very much for having me. Thank you for sharing all of your stories. It's been wonderful.
Oh, thank you. Thank you, Natalia, and thank you, Vic. Can I just get another round of applause for all of our speakers today? That was incredible. And I wanted to also wrap up, not the conference, we're not done yet. We're going to go into the fun stuff in a second. The magic making part of it, as I would like to call it. But I just wanted to share this slide just to recognize that September is Suicide Prevention Awareness Month. A time to raise awareness, promote hope, and normalize help seeking. Suicide, as y'all heard, affects millions of people every year, yet many of them struggle in silence. So whether you're facing challenges, you're supporting a friend or a loved one, or you're looking to find help, your voice matters. This month is dedicated to recognizing the warning signs for suicide, encouraging open conversations like we're having now about mental health, and then again, connecting people to proven treatment and resources. So I just wanted to point out that we have obviously the 98 Suicide Lifeline, and when many of you were speaking and nodding, I know several of us, I didn't even know if we really introduced ourselves. I'm Tanley Powell-Biggs. Formerly with SAMHSA, I was the Deputy Director for the Office of Behavioral Health Equity, which is our Office of Minority Health. And Perry Chan was also in my office. He was our community engagement, social science analyst. Just incredible work that he was doing with the communities. And I want to recognize Becky Zornick. She was our deputy director for our policy office. She's also our trauma-informed and children and family lead expert as well at the agency. And I'm just pointing this out because everything you're hearing that's coming from the state, county, school, community, provider levels, all of these programs, we're all in the same boat together. We're really trying to find ways to continue this work, to address these challenges, because there's work to be done, clearly. So I just wanted to point that out as we engage into the next piece, our open dialogue. And we have about 20 minutes before we wrap up, and then we'll get to hear from Dr. Holton to close out, and then a group picture, which we're going to stay in our seats. Our photographer is amazing. He's going to be able to take a picture of us just sitting down. Beautiful panoramic picture, and then we'll have dinner shortly after. And thank you to some other folks as well. So let me just start by hearing from, again, all of the presentations you've heard today, and I will go into the list of questions. But before I do that, I just do want to open up the forum to say, do folks have any questions for our presenters? Because we went through that fast. So any specific questions or comments or thoughts that anybody would, and we'll pass the mic around, I would like to say or ask before we kind of jump into how to save the world, before we jump into the next segment. No questions. Okay. Yes. Oh, yes, Leanne.
I also I forgot to mention that with us expanding in the past couple of years, we have a triangle partner or chapter, we call it. So we do have a Monsignor Association of the Triangle in North Carolina. And I've been trying to get connection with the Triangle Foundation, and I have no luck. So I did make an office hour, so to meet with you, to meet with our program coordinator. Just wanted to put that on your radar.
I'm glad the QR code actually worked.
Thank you. Thank you, Leanna. Thank you, Natalia. Any other questions or comments? All right. Okay, let's put our thinking hats on before dinner, like Perry said. Everybody has to speak before you get to eat. So, these are kind of tiny and small, I apologize. And we don't have to answer every single question. Let me kind of just read through them, and then I think maybe the best thing to do after that is to kind of maybe have folks pick and select the ones that you want to comment on or provide some feedback around. And so I think we heard a lot of themes. This is just my impression. I heard a lot of themes. I think partnerships, collaborations are going to be key. Resources, bringing people with lived experience and their family members to the table is also key. I think we have to figure out at this point, in this juncture, how do we move forward? Some of these questions reflect that, right? How, for example, from your perspective, how can communities, organizations like UCA Waves continue to build these systems and sustainable partnerships? How can government agencies, community providers, and funders better coordinate to reduce, okay, this is really hard to read. Sorry, Perry, I'm gonna try and squeeze the text box. Service gaps. Okay, I'll just read it out loud because it's really tiny. How do we ensure that lived experience voices from communities are meaningfully included in shaping policies and programs? And then again, we had heard from Natalia and also from Vic around the funding proposals, right? What do they need? And the word, and Lily knows this about me, data. And yes, it is really unfortunate that at the moment, federal government data is changing, disappearing, being changed again. So I would really strongly hear what Mr. Armstrong was saying. You really have to look at your data, and you have to pair it with the stories. And you use that to identify what those challenges and gaps are. So those are all really, really key. Let's see, what else is there? Oh, looking ahead, thank you, Perry. Policy changes and funding strategies that will help most move the needle for AAPI mental health equity in North Carolina. And then lastly, we'll touch upon, some next steps. What should we do today as a group moving forward? And then, of course, some strategies. Let me just back up to say, this is a lot. You all heard a lot today, and this is a lot to try and answer. But this is the beginning of this whole initiative around how do we collaborate, how do we partner, how do we move the needle forward. And again, back to the purpose of this meeting, we're really trying to help UCA Waves figure out the direction of where things are moving and how we can get there, right? But I think everybody has a piece and a part to play in it, and we can play really well together. Okay, I'm off my soapbox. Reactions, comments, yes. And please introduce yourself too, so we know who you are.
Hi.
Ooh, I guess I'll stand here.
Should I stand here? Okay. I'm Bethany Wagner. I'm with the Department of Health and Human Services. with a brand new office. I think is that me? Okay. And so what we're looking at is overlap. So today we're talking about mental health and how it overlaps with so many things. Like your mental health isn't going to improve if you don't have food, you don't have a place to stay, you don't have a community, right? Well, my partner Vicki and I are looking at accessibility. So I'm actually here representing two places, the Office of Language and Communication Access, but I'm also representing the Division of Services for Deaf and Hard of Hearing. So just like the Asian community is ignored and not included, so is the deaf community. And here's my dream, okay? So I think it's a little dream sharing. Let's share some hope and joy. I want all of you in a room with my deaf people. I want to have sign language interpreters, Mandarin interpreters, Spanish interpreters. I want all of it. I want it to be multilingual and beautiful and showing the true joy and hope of North Carolina. And I'm starting that work in my office. Now, my office is baby. It's me and one other person. But what I wanted to say is I'm looking for a partnership. We want your voices. Your voices matter. There is some movement happening. We are getting in different leadership places, and we want to know who you are, and we want to invite you to those spaces. So please come get my email and my phone number and partner with us. And thank you so much for having us. And all of you in this room matter. And I want you to hear that from a government person. I want you to hear that from a person that's a stepmother and a mother and a wife and a daughter. So thank you so much.
Thank you. Thank you, Bethany.
Yes, hi everyone. I'm Cheryl Stallings. I'm one of your Wake County Commissioners, and I'm also a mental health professional. So I just want to comment about the concerns at the federal level and the state level with maybe some challenges that may not be consistent with the values that are being shared here. But I just want to say I think now more than ever, these partnerships is what's going to see us through these difficult times. And I just want you to know your Wake County Commissioners, which is your county government, is very committed to this work, and we stand with you. But more than ever, we've all got to join hands and hold on real tight to get through these next few years and hopefully get to the other side of this where we can really sort of be rowing the boat maybe in the same direction better. But we've got to show up for elections, and we've got to get more and more people in our state and federal government, I think, to value these concerns. But I just want you to know your Wake County Commissioners are on board with you and support you through this work every day. Thank you.
I'm Cristina España. I'm the Senior Outreach Advisor with Governor Josh Time. It's a pleasure to be here. My work has to do with serving new Americans, meaning all foreign-born. And I see so many champions and friends in the room, so I'm really happy to be here. Give a round of applause. We met like 1 week ago.
And you're here.
And I'm here. And that just speaks to the fact of how powerful this organization is. And I'm so happy to be here. Thank you.
Thank you. You look like you're about to say something, Mr. Armstrong. Do you want to know?
I'm calling you back. Thank you. Go ahead.
Hi, I'm Becky Zornick. I'm worried this isn't going to be the hopeful,
It's okay.
dream making, but as someone who has been in government for the last 14 years and was taken out of government, there's obviously the elephant in the room, and I appreciate you bringing it up. I just think it would be a really big mistake to go through these questions and try to answer them as if this was, like normal, times were like normal. And I feel like we all have that inclination to do that because we want times to be normal and we want to say, yes, if we have the right data and we have the right, justifications, but I don't know what the answers are, but I do think it's a time to look at these questions and think about the current context and, what actually will get us through this. So again, I don't have the answers, but I just wanted to name that.
I appreciate that, Becky. Thank you. Any other?
Yes, of course.
I was not expecting to speak, so I was not ready. I didn't know that we had to answer questions. I think what I can say is I come from the governor's office, and I see the governor, Judge Stein, I see our staff, I see DHHS that is incredibly active, and I can tell you, we're here working for you. I can tell you that there's amazing staff all over state government, and everything is moving. I know states are different, and the dynamics of the country changes depending on where you are. But I can assure you that in North Carolina, the government, particularly state government, because that's where I work, but of course county, but I can assure you that the state and the governor is working for all of you. And the way that you can see that it's happening is that I work for him, and I have an accent, and many of us look different, and we work in state government, and we are part of government, but also part of the community, and we do have the lived experience, and to change the system, you have to be part of it.
Thank you.
Hello everybody, my name is Mo Shenju. I'm representing 3 organizations today. I'm a volunteer of UCA Waves to begin with, and I'm also representing Carolina's AAPI Business Alliance from a business perspective, but I'm also a founder of a nonprofit which is called APEX Learn. And throughout the years, I realized that since I have very little kids, and it took us 7 years actually before we started to have kids. And the first time, actually, I was at UCA meetings of the mental health, I was shocked to see how much and how severe that our community is suffering from mental health issues. And later on, I went through, thanks to UCA Waves, I went through some suicide training, prevention trainings for teenagers. And then I realized, actually, I also through that event, I was able to connect with several psychiatrists and also psychologists, and so that I formed these connections with them. But over the years, I realized that it's not only the last resort that's important, but it's also the resources and collaboration between different organizations. Like, I'm representing 3 organizations, but all the organizations, if we can collaborate together and focusing on the same path, it can be super powerful. But also, what's important but not last but not least is the awareness and learning. We had joked about when we first launched our parenting class from a positive discipline in our Chinese community. We were having this idea, okay, for the parents who haven't had kids, or their kids are from 0 to 3, it would be free of charge, or we would compensate them to come over to learn. From 3 to 6, free, from 6 and above, we would charge. So the concept of that is that there's a concept in Chinese medicine that we cure illness when it hasn't happened yet. But when it's already severe, it's really hard to stop, right? So one thing that I want to bring up to the board is that how can we move this ahead of time so that we can bring the awareness, the learning, and sharing it with our community so that they can really benefit ahead of time rather than when it's too late. Thank you.
Thank you. And what you just said basically defined prevention, right? And I think in the space that we work in around behavioral health, prevention is probably one of the hardest things to actually measure, right? It's kind of like when the CDC back in the day had said, you know, Million Hearts campaign, we're going to prevent 1 million heart attacks. How do you count that, right? How do you count, you know, prevention of opioid overdose, right? Or suicide, right? And, I mean, people count attempts, but again, you know, even just thinking about it, right? All the different pieces that you're saying, but I think it's probably the most powerful and probably the biggest space that we have to fill.
Because you're right, by the time they have to enter the behavioral health system, and I know many of you experience this, you have to wait months, right? There's a crisis, your child goes through something, you go through something, your loved one goes through something. Fine, we call 988, text 988, there's a message that's referring to somebody, or even the CCBHCs, but the next thing you know, you're waiting months on end to see somebody. And meanwhile, the person is still in crisis, right? So there's so many different, I think, gaps that we have to think about between having people who know how to provide services in a culturally, centered manner, people who are, like myself, in the actual behavioral health space providing direct services, how to do the prevention side, all the way to the treatment side, and then how do they get back into the community, right? So there's a spectrum that we have to look at. And the question is, what role do we all play along that spectrum? And I think there's lots of opportunities, whether it's, and this is just me brainstorming now because obviously we had thought about this before we put these questions up there. Things like, for example, SAMHSA used to fund the Minority Fellowship Program, where we were basically paying for higher ed professionals, right, behavioral health professionals, to go into behavioral health care. And that program may not exist. Then the question then becomes, for all of the beautiful universities and colleges in this area, as they're placing students, because I'm a social worker, I had field placements,